Good morning to all of you. Welcome to Legal Matters by Sai Babu Sankara. In this video, we are going to discuss a case of medical negligence which is not proved in view of the Honorable Supreme Court of India. Honorable Supreme Court of India, two judges bench, A.S. Bopanna and Prashant Kumar Mishra. In the case of Mrs. Kalyani Rajan versus Indraprastha Apollo Hospital, Dr. Bhatt and others, in civil appeal number 10347 by 2010, dated 17/10/2023, held that if medical complications are not due to the procedure, then no medical negligence. No doubt there may be complications. If they are not due to the surgery, if they are outside of the surgery, then you can't say that it is a case of medical negligence. Supreme Court cited the famous case of Jacob Matthew. We'll discuss it in the later part of this video. Coming to the factual matrix, please remember, on 1998 itself, 29/10/1998, the husband of Mrs. Kalyani Rajan, by name Shankar Rajan, he contacted Dr. Bhatt due to his type 2 neurological problem. Some medical name is given. I can't remember it. Then Dr. Bhatt told him that better to undergo neurosurgery. Immediately, on the next day itself, on 30th October 1998, he was admitted in the hospital. The neurosurgeon, Dr. Bhatt and others, they conducted the surgery. After the surgery, the surgery was completed by 11 a.m. By 4 p.m. or so, he was shifted to the room. From 4:15 to 4:30 p.m., this man complained of severe neck pain and slowly it has converted to gas problem. Ultimately, around 11 p.m., almost after 12 hours of the operation, he suffered with heart attack. From 4:15 to 4:30, almost for 15 minutes, no doctor attended on him. This is the main problem. Wife said, even though she moved in the ward from one room to the other, no doctor came. As a result of which, her husband got the so-called heart pain. Ultimately, he was put on the life support, or you can say ventilator, up to 6/11, where he was declared dead. First he is brain dead, then he was declared dead. So now the wife says, because of the medical negligence, because no doctor attended on her husband from 4:15 to 4:30 p.m. and later only they came. So this is a sheer case of medical negligence. Second point she says is, after the surgery is over, he should have been shifted to ICU, Intensive Critical Care Unit, ICCU. But he was shifted to the room, as a result of which this complication has come. So the matter went up to the National Consumer Dispute Redressal Commission, but they negated it. They did not give any compensation to her. Now the matter has come to the Supreme Court. Supreme Court clearly, Supreme Court is apprised of the procedure to be adopted. Normally, whenever the surgery is completed, the person will be kept there itself for about 2 hours to check up whether any post-operative complications are there. He was there in the room for 2 hours, right from 11 a.m. to, the surgery was complete 11 a.m. 11 a.m. to 4 p.m. he was there. Of course, they were waiting for the room. Ultimately, around 4 p.m. or so, he was shifted to the room. So, the procedure says that If no complications are there within these 2 hours or 3 hours, then he can be safely shifted to the room where he will be given some treatment for about a week or so, then he will be shifted. That is the routine procedure. But the procedure of admitting him ICU is not at all there. Second, the medical negligence here, according to Mrs. Kalyani Rajan, res ipsa loquitur. You know, res means res ipsa loquitur means thing speaks itself. The negligence speaks itself. But whether you are able to prove the res or not, please remember here the res should be proved with a strong cogent reason, but it's not proved. The doctors, yes, definitely. The team of doctors also said that the problem of heart, the heart problem is not due to the post-operative procedure. Finish. Now, the Supreme Court also held that we can't do appeal dismissed. Right. Now, they have stated the famous case. Jacob Matthew versus State of Punjab. Jacob Matthew versus State of Punjab, if I am correct. Yes. 2005 case. Second case they have depended on Bombay Hospital and Medical Research Center versus V. Asha and others. V. Asha Sainasana. So these two cases they have cited. You know Jacob Matthew case, where no doubt the doctor came lately, but he was attending on another patient, which is more important, which is more critical. So in such a case, you can't find any negligence on him. Here also, the doctor came, of course, not, as a layman or as a patient's relative, we are in a hurry. Definitely, we expect the doctor to come, at least the nurse or somebody, junior doctor should come and attend on him. That's sufficient. But nobody came. But the Honorable Supreme Court of India stated that the prosecution or Mrs. Kalyani Rajan could not prove her contention beyond all reasonable doubt because the medical procedure says that yes, they can shift him to the private room. As a result of which, so please remember, as the complications are unrelated to the medical procedure, it is not a case of medical negligence. Negated. So please read the case law and enrich your legal arts because they will be definitely useful for you in the future course. Thank you.